Dear aquarist, dear fish keeper, for those that are learning to take care of fish, I'm happy you're watching my fish disease cases. And always there is something interesting to report during my work, and I hope you share my knowledge, you use my knowledge, so you are happier in taking care of your fish. And today it's about case number 105. It's about a dwarf cichlids, Apistogramma baenschi, tank raised in Europe. They became sick, and we had one dead fish. And we found a bacterial infection that might kill soon more of the other fish in the aquarium. And here I show you the video of the fish in the tank. They look pretty okay, maybe a little bit stressed. Some look a little bit skinny. And here we had one dead fish. Well, it usually starts with one dead fish, and maybe the next days there are 2 dead fish, and within a week 5 dead fish. Well, it's time for you to take action when you see one dead fish, to look at the fish. Look here, how skinny this one looks. So there is some problem going on. And we watched again here in the other video, we see some of the tails of some of the apistogrammas are damaged, not perfectly formed. You can see it here in the back. It's difficult to see because they are very active. Some are behaving a little bit shimmies, shaking, and here rest on the bottom, wasting away a little bit. So maybe that one is going to be dead tomorrow. So we check the fish of the fish, his skins here. We see the tail. We see here some tail rotting away. So here some parts are necrotic, going away. We see the gills. We saw gill rot. This is typical bacterial infection. Here the filaments which are rotten away, making holes, necrotic tissue. So the filaments are not working anymore. So less good respiration, difficulty breathing with the fish. Here, this whole part is gone. Here's some reddish inflammation. So it is a bacterial infection going on. And also in the internal organs. Here you see the liver, which is reddish with patches inside. We see here the spleen with melanomacrophage centers. So there's an infection going on. And particularly there are some bacteria also internally. There's some bleeding patches here. You can see the intestine. So the ovary here, the gonads, we see bleeding patches inside between the eggs. This is not normal. It should be clear. It should be not so red bleeding patches. So it's most likely a bacterial infection, and that you can define by sending the fish to the laboratory to make a bacterial culture, to do sensitivity testing. Then you can find what antibiotic to use. But here in the tissue, you see the millions of bacteria already in the fish. So what treatment can I suggest? Well, you have to act quickly. You will be more happy and more successful with your treatment if you do it as soon as possible, particularly when the fish are still eating, and they can strengthen themselves when they are eating. When they're not eating anymore, it might be too late. So we suspect a bacterial infection, and your fish doctor can help you to implement a good antibacterial treatment or a proper antibiotic. At the same time, you can feed with our functional fish food, Dr. BASSLEER BioFish Food, grapefruit seed extract, MORINGA or FUCO, for at least 20 to 30 days, and meanwhile no other food. So the fish have a full load of healthy, functional fish food. Learn more in my books. I explain a lot about many different fish diseases, also about dwarf cichlids, particularly in my big book, The New Illustrated. I have a lot of details on dwarf cichlids. And my Patreon channel, I'm giving you more exact details on training on fish diseases. So another case that I share with you to become a successful aquarist. Thank you for watching.